Welcome back to the Black Health Lit podcast. This is a space where we can be Black, proud, and healthy. As a reminder, the information shared here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. While you're here, check out the episode description to learn more about today's guest and shop Black, Proud, Healthy merch. When you shop merch, you're helping to support future episodes and free health education for the Black Health Lit community. Lastly, make sure you like, subscribe, and share this episode. All right, welcome back to the Black Health Lit podcast. Today, I have the pleasure of talking with Dr. Kre. Before we get into today's topic, can you introduce yourself to my audience?
Yes. Hi, guys. I'm Dr. Kre. I am a board-certified family medicine physician, and I specialize in helping everyday, overwhelmed, overworked individuals learn to live a healthy, happy, whole life. I am a primary care physician in Birmingham, Alabama, and we do all the things to help you have prevention, wellness, and wholeness.
All right. Thank you so much. And you also have a nonprofit, which leads me to my first question for you, Dr. Kre, about STEM careers and how important that is. So can you talk a little bit about how the Black community can address underrepresentation in STEM careers? So science, technology, engineering, and math is what STEM stands for, careers, and what resources are available to support Black professionals in fields like engineering?
I think one thing that we could do as far as the underrepresentation of STEM is getting our exposure out there early. You know, oftentimes we think of exposing our kids to doctors and lawyers and entrepreneurs, nurses, but we
Yeah.
don't think about the likes of engineering or computer science because maybe you're not really thinking of those as STEMs or your parents weren't thinking of those. So I think one thing's for sure is that we have to start early. As far as a
Yes.
resource, if you are a in that field, you can start telling people about online. You know, everybody's Googling everything. Google out there and see what is in your area, who is in your area that are some engineers. You'll be surprised at the things that engineers do. Who are some computer
Yes.
science people? And then look for those for mentors. There is a website out there that's called EIE, like elephant.org, and it's
Okay.
listed as the Museum of Science, but it says that engineering is elementary. So they have some programs for pre-K through 8th grade, and they start teaching kids and exposing kids at an early age. So I would say that that's a really good resource. One, see who's in your area, see who goes to your church, see who's working in the neighborhood. You may be around engineers and the likes of STEM professionals every day and not even know it.
Right. Absolutely. My sister is a chemical engineer. So I'm around, or not around, but I talk to an engineer all the time. So I don't even think about it. So that just speaks volumes about exposure. And my mother's a registered nurse, so she falls in that STEM category as well. So let's talk a little bit about
Yes.
entrepreneurship. You mentioned entrepreneurship. What role do you think entrepreneurship plays in empowering the Black community economically? And then second part to that, what specific challenges and opportunities do you think Black entrepreneurs face in industry, specifically like tech startups or small business? And I can answer on that one too after you.
Okay, cool. I can answer in two ways. I am in small business and my husband is in tech. So I've seen it kind of on both ends. One thing is that entrepreneurship and economics, for me, when I started my business about 12 years ago, we had an issue with funding. You know, we needed a line of credit. And we went to a lot of the big box banks and they were like, no, we're not gonna give you a line of credit. So we ended up going to a credit union, which you don't think of a small town bank that's just in your state, and supporting them. And they gave us our very first line of credit. So now I'm loyal to them. So when that vice president went to a new bank, I went to the bank with him because I'm like, if you're gonna give me my money, I need to stick with you and stay with you. So I
Yes.
think that one thing is for sure is that funding is huge. People are afraid to leave their 9 to 5 because they don't have the funds. They don't have the ability to say, I can borrow, I can do all of that. So one is the funding. Another thing is we need to make sure that when we're in those communities, we're giving back. Like most of my staff
Yes.
is African American. So I am hiring staff that look like me. I am giving back to the community in that way. And then we're also using community resources. We're using the mom and the pops. We're using the
Yeah.
local compound shops. We're using the local pharmacies. So that's from a medical standpoint. And I think as I'm watching my husband go through all of this, he did Techstars, and you have to apply to all of these big things. And you're
Yeah.
like, funding is huge, but you have to have that exposure. You have to have
Yeah.
those role models. You have to have those mentors because otherwise it's all for nothing.
Absolutely. And I can agree with you 100%. Money, money, money. Funding, money, money. We need money. And when we have the conversation about generational wealth and some of the systemic barriers that Black people and African Americans face in this country, money is one of those things. It doesn't solve for it, but it's one of those things that can help us to at least have a better fighting chance to be a successful
Yes.
entrepreneur or business owner. We don't take out enough funding. We don't have access to the funding in the first place a lot of times. And sometimes that access comes in the form of just simply not knowing what opportunities are out there or what funding sources are out there. And then secondly, not getting approved for the funding for whatever reason. So you hit the nail on the head with the money piece.
It's
That is
huge.
big. It takes money to make money, and it's cliche, but that is so true. And it's something that I have, as a business owner and serial entrepreneur, have struggled with and had to come to grips with. It costs money to make money.
It makes
Period.
the world go round. It makes the world go round, right?
Period. Yep. Yep. So let's pivot a little bit and talk about, because you have your hands in so much. So you have your nonprofit,
Mhm.
and you're helping with STEM access and exposure. You are an entrepreneur. Your husband is an entrepreneur and in tech. You all are covering all the bases. You got it covered. But you are also a medical doctor.
Yes, that's my
So
first.
I don't know when you sleep. How do you sleep? Let's start there. That wasn't a question, but I'm curious.
So what I do, I ascribe to is I protect my time. So you can have all my daytime. And so when 6 o'clock comes, we have a 10-year-old. I make sure that I'm off to take care of her, get her home. And then when he gets home, he doesn't even know Dr. Kre exists. I'm out of my scrubs, I'm in a robe, and I'm in a bonnet. So I'm
I
able to
know
be
that's right.
I'm able to be there and to be present and to be his wife because Dr. Kre fusses. Dr. Kre is, in that space. But now we don't have to do that because I'm simply being his wife and her mom after hours. So that is how I sleep because I unplug.
I love that. And I think that's a misconception about successful women often is we're on all the time. You're always big boss. And it's like, no.
That's
No,
it.
no, 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 no. Big boss
No,
out there is different than mom, wife, just woman first, mom, wife, and the aunt, sister, all those things are totally different people. Like I always joke that I have an alter ego. I have three of them. I have my corporate, like business, no games play is corporate Connie.
yeah.
And then I have Rachel, which is more so like, my outside of my money maker.
Uh-huh.
That's what my friends and other people get in the world. But then I have Ray Ray.
Girl,
And
you
that
get it.
is who my family gets. And
I
she
think
is
it's
the
that.
most raw form of me.
Yes, yes, yes. I think that's how we survive. You have to move in and out of those places. I say the same thing. I'm like, I'm putting Dr. Kre on. She's going out. When I get home, you might get Kre, you may get Aunt Kre because that's my government name, depending on if my mama calling. But you
Yes.
have to be able to compartmentalize it, and you have to say no. Like no is a complete sentence. And if you're saying yes and you're reluctantly saying yes, you may as well have said no because you're gonna be mad that you signed up for it.
You sure will. You sure will. So I digress for a second. So let's get back to your medical side. Let's talk about HIV. It is still a lot of stigma around HIV, a lot of misinformation, but it is something that is hammering still today the Black community.
Yes, it is.
What are some of the unique challenges faced by the Black community when it comes to combating HIV and AIDS?
So one of the unique challenges that we have is access to care. So a lot of doctors aren't out there prescribing HIV medicines, prescribing PrEP. We'll talk a little bit more about PrEP in a bit. But because your regular primary care is not writing it, you're not seeing it out there. No one is talking about it. You may be afraid to get tested. Then you're already behind the eight ball. Because, yes, it's men who have sex with men, but on the rise is African American women in getting that diagnosis of HIV. Now, so we have that stigma because we don't have the access to care. So we have to be
Yeah,
creative. I have started a nighttime clinic here in Birmingham where people can come if they have insurance. If they don't have insurance, we offer them the care. So, which is amazing because we do PrEP, which is the pre-exposure prophylactic medication. You may have
yeah,
seen commercials on at night. And
yep,
part Yep, they have. You would think that it's just for men who have sex with men, but it's for anybody that's having sex with
yeah,
anybody. You can be on PrEP. Think about it as we did birth control back in the 70s, right? So here we are. We're able to take a medicine that can prevent you from getting HIV because oftentimes you may think you know your partner status, but we really don't know. You only can have what
right,
people are telling you unless they show up with recent, paperwork that say that they're negative. So we have
right,
the primary care, but now that we have it, then you're like, I don't have insurance or my insurance doesn't cover. So you have to be creative in finding those clinics that have, hey, we're going to go the extra mile. We have the social workers. And most big cities have those kind of clinics. But if you are in a rural place in Alabama, we have the Black Belt. You may have to drive 30 minutes, an hour, even
right,
more to get that care. So for us, the challenges are you're going to have to be very creative. You're going to have to do some Googling and looking, but you're going to have to also say, am I open to not just going to that one doctor? Back in the day, mama had that one doctor. We all went to the same doctor,
the
but old,
same
old and
one.
gone are those days.
The same one. That's funny. My one of my guy friends that I'm really close to, we just talked about how in my hometown, Dayton, Ohio, there was one doctor the whole hood went to.
Whole hood.
And you would be there all day.
But you
And
weren't
this
going
was,
anywhere else. You weren't going anywhere else. That was where you were going.
oh my God, he was the family doctor for all the families. But you bring up a really good point about the stigma. No, people don't want to get tested for fear, or people think I know my partner, so
That's not
we're good.
no.
And you said unless you see a recent test, because just because when you started the relationship at year one and got tested together with that both of you were negative doesn't mean 2, 3, 4 years later both of you are still negative, because infidelity is a thing, or open relationships, whatever is going on in your relationships. So what are some of the things, you mentioned PrEP. I see PrEP on the benches around my neighborhood. I have heard from pharmacists and other doctors that PrEP is the way to go, that Black women should be using it like it is a birth control. And I've also heard that, on the other side, some people feel like, well, why are they marketing this to Black people? We tend to be a little defensive, especially when it comes to healthcare, right? And prescribing something.
Correct.
What is your insight on why PrEP is so important for Black women and the rest of the Black community?
I think that is so prevalent and a need for us because we're on the rise for being the ones who are getting a new diagnosis. So when they say that and they're targeting us, it's because they've done the research to say, we've heard all about the down low brother. The
Yeah.
man is having a relationship with a woman, but is secretly having a relationship with a man on the side. So those are
Yeah.
the things where we are more at risk based off of our partners. And if you don't know what your partner is doing, then we need to be taking the medicine to protect ourselves, because we're the mothers, we're the grandmothers, we're the ones
Right.
doing rearing, that kind of thing. So for us, it is because those numbers are on the rise. We're the leading ones getting it. Oftentimes we're getting it from men that we don't realize they have these alternative lifestyles. So yeah, we're
Yeah.
different, but there's literature that backs that up.
Absolutely. And I like that you use the proper verbiage of men who sleep with men, because in the Black community, especially in America and in the Black community, especially, we think HIV, even in 2024, people still think HIV is a gay or homosexual man disease.
Yeah,
And what we have learned, especially in the past 5 to 10 years, is a man who sleeps with a man may not necessarily identify as gay, bisexual, homosexual, pansexual, any of the sexual orientation identities, but that doesn't mean that he's not a man who sleeps with men. So I
correct.
love that is a term, because it speaks to the behavior of men sleeping with men versus a label or an identity that may not resonate with people. Because if you offer a clinic and say, all the gay Black men come over here and get tested for HIV, they ain't coming. But if there can be some anonymity and privately be tested men who sleep with men, I would hypothesize that more men would get tested if that is the labeling of it.
Correct, correct. Or if you just say in general, we have prep. In general, we're doing testing.
Yeah,
Those we just try to keep it as general, and we try and make it just not so much of a status or the stigma. And we want to say these are your risks. We're looking at, are they high risk? No, we need to be talking about, we're not necessarily high risk or not, but these are the reasons you should be tested. These are the
right.
reasons on prep. So looking at it from the reasons and not so much as the risk.
Yeah. Yes, that's excellent. Do you think that the stigma is being reduced around HIV and AIDS and testing, or is it getting worse?
I don't think it's getting worse or better. I think that is something that we choose to ignore. You know what I'm saying?
Mm,
I think it's something that's there. We're not going to talk about it unless we got to talk about it, right? So I don't think that
okay.
the stigma is any worse. You got to have some symptoms. You got to have something that pushes a lot of people over to getting it test done. Not just, I'm just here to get screened, unless you are high risk and you're in that
Right.
high risk category and you're used to doing that. But the regular mom, pop, Sally, and John, no, that's not us. But I think that we just ignore it. It's not our thing. It's not our community, so we won't talk about
Yeah. Okay. Which is unfortunate. I guess it's better that it's not getting worse, but HIV AIDS in the 80s was huge, and you would think by 2024 it would be commonplace when we're talking about our health, but unfortunately it's not.
But let me just add, Ray, that people are living longer with HIV. The medicines are amazing. In the 80s, you probably was taking 15, 20, 30 medicines. Now I write one pill. You got one pill.
Wow.
In that pill, you may have three different, medicines in one pill, but they're taking it. Their levels are getting to be undetected. So I can get their levels down within 3 to 6 months of them taking the medicine. So
Wow.
those people are living long lives, and they're not necessarily dying from their HIV. Now, they may die from diabetes and heart disease and cancer or something else, but if they take that medication every single day, see their doctor a few times a year, you're likely to die from complications of your heart disease or your diabetes than complications from your HIV.
Wow. That's phenomenal.
Mm-hmm.
That is
Yep, it is.
phenomenal. I had a cousin who was HIV positive and this was back early 2000. He's probably been dead about 10 years. Um, but he lived a long time, like 20 years that I
Yeah,
know about.
exactly.
So, yeah. Okay. So that's good to also know that the amount of medications has gone down because
Yes.
you would see, I've known two people, family members or close family who had HIV, and it was a lot of pills.
That's
But
not the
one
case.
pill is, most people are taking more than that just for regular chronic conditions at this point.
Just for high blood pressure.
Yes,
Right.
yes, yes, yes. Okay, well, that's good. So let's talk about disparities in heart health. That's a great segue. You mentioned heart disease and diabetes. From your perspective, how can we address disparities in heart health within the Black community across all socioeconomic, statuses and access to healthcare?
So first thing for women, coronary artery disease is the leading cause of death, you know? So we're looking at things like, is stress a factor? Is our diets for sure factor, because mama and grandmama taught me how to cook those greens. They taught me how to cook the dressing. They taught me how to cook those chitlins, whatever it is, and we pass those things down to our family. It doesn't matter that I'm a doctor. Come Thanksgiving, I'm gonna have my macaroni and cheese, my ham, your pig, whatever it is that you're gonna have. So some traditions for us surpasses our socioeconomic status, right?
Oh yeah,
That I think that is a big thing as far as one of the big disparities is one going to be our diet and exercise, because we don't eat
yes,
to live, we live to eat. We're eating to celebrate our everything. I'm happy to eat because it's my birthday. Well, I'm sad because I got a demotion. Let's go eat. We're eating and eating and eating, and that's not necessarily the best foods when we're out there celebrating. So our diet, we're not necessarily exercising the way we need to, and we don't know our family history. So because mama didn't tell us that, ooh, big mama had a heart attack, or big mama
yeah,
had diabetes, we don't go to our doctor and say, hey, my diabetes runs in my family, so can you watch my sugars? Or
yeah.
heart disease runs in my family. Maybe I need to go ahead and start seeing a cardiologist before something happens. So we are eating bad, we're not exercising, we don't know our family history, so we can't prevent, we can't
Right.
screen early. So all of these things puts us behind the eight ball, no matter how much money you make, no matter what neighborhood you live
Absolutely. And you are right. We love to celebrate. I am guilty.
in. Me too.
Uh I am guilty. Now on a day to day at home when I cook, I don't fry. I
Mhm.
don't buy bread. There's a few things that I just eliminate from my home diet. However, on the holidays, especially Thanksgiving, I will have some
Yep,
ham, some mac and cheese, cornbread, collard greens.
all that.
Okay.
Right.
All of it. And people will be like, and I like when it touches all that. But on a daily basis, for the most part, we should be eating pretty healthy. Talk with our primary care doctor, a nutritionist, or registered dietitian about a healthy diet and what that means for us, considering our underlying conditions, age, gender, things like that.
Yes.
Not just a generic meal program we found on TikTok.
No, no, no.
Yeah,
We need
because that
to
stuff makes a difference.
exactly individualize.
Hmm. Yes. Okay. I like too that you included it spans across all socioeconomic statuses. So whether we are living in poverty or upper middle class, we're still, or upper or rich, wealthy, whatever, some of the things are still the same regardless of how much money we got, where we live, and all of the above.
Correct. Correct.
Okay.
We
All
are not
right.
exempt.
You talked about family history. Family history is huge. I know that some people think, oh, there's no genetic predisposition. It's not because mama and daddy and grandma and grandpa had it. It don't mean nothing. Yes, it does. But it's not a death sentence. I don't think that it's a sentence to if everybody had diabetes, you're going to have it. I don't think that, but it does play a role. So why do you say, as a doctor, hereditary diseases appear to be more prevalent in the Black community than maybe some other demographics?
I think more of what we just said, because we pass down those traditions. We pass down those on Sunday. We're gonna get together after church. Everybody's getting together, so it's not like we just eating bad on Thanksgiving. We add those Sundays in there for years and years and years, and then we pass those traditions down. We pass those recipes down. So now we're at more risk for diabetes, which is something that you can change with your lifestyle. We're more
Yeah,
risk for heart disease because we're eating those high fat diets. We're eating the cornbread, the hot water cornbread, all the butter,
yes,
all the things. So a lot of the hereditary, when you think of the hereditary, the big three, high blood pressure, diabetes, high cholesterol, slash heart disease, all of those have a lifestyle change component. If you change your lifestyle, if you back off the salt, if you exercise, your blood pressure get better. If you back off the
yeah,
sweets, back off the carbs, your sugars get better. Those
yeah,
kind of things. But we are more, I think we're more at risk for hereditary illnesses because we are doing it. We passing down that thing. Grandmama was doing it. We're going to keep